So let's talk about the enlarged prostate. I'm Dr. Kent DeLay, a board-certified urologist practicing in West Columbia, South Carolina, and today I'm going to talk about BPH. BPH, or benign prostatic hyperplasia, is the medical term for enlargement of the prostate. The prostate is a small gland which sits below the bladder and makes fluid involved in the transport and survival of sperm. It can become a problem for two reasons. One, a man can be affected by prostate cancer. Or two, the prostate surrounds the urethra or urine channel, and when it becomes enlarged, compresses that channel, making the flow of urine more difficult. So while it is a simplification, I tell men to think about this as a plumbing problem. When the prostate becomes enlarged, the pipe becomes blocked. The prostate grows as a man ages, so enlargement of the prostate and the symptoms that follow become more common as we age and become very common after age 50. The symptoms of an enlarged prostate can include a slow urinary stream, starting and stopping, dribbling, getting up at night, urinary frequency and urgency. Another reason that an enlarged prostate is important is that prolonged blockage can affect the function of the bladder and eventually cause it not to squeeze, resulting in retention of urine. I tell patients to think about this like heart failure. In heart failure, the pump becomes less effective. The same thing could happen to your bladder muscle after it has been blocked for a prolonged period of time. What happens is this muscle becomes damaged, and this is usually irreversible and can result in the need for long-term catheterization. For this reason, it is best to address urinary symptoms before they become too severe. There are both medical and procedural treatments for enlargement of the prostate. Medical therapy includes pills which relax the prostate, such as Flomax, and pills which shrink the prostate, such as Proscar and Avodart. I tend to avoid these last two medications in sexually active men as they can cause significant and potentially irreversible sexual dysfunction. The medications which relax the prostate, such as tamsulosin, the generic name for Flomax, are very commonly used. They are quite safe, but occasionally are associated with dizziness and orthostatic hypotension. This is dizziness when you stand up. For this reason, I tell patients to start the medication right before bedtime. Also, these medications can cause loss of ejaculation or weakened ejaculation, but this is reversible once the medication is discontinued. While there are more procedural treatments that can be covered in this video, I will just briefly say that the goal of all of these treatments is to create a wider channel for the better flow of urine. Historically, men have only been offered a procedural treatment for enlargement of the prostate when medications have stopped working. Now, with more newer and minimally invasive office-based procedures for enlargement of the prostate, we are giving consideration to those procedures even when the medications are still working to avoid the lifelong need for a medication. This is something that I discuss with most of my patients. Ultimately, what is right for each patient is their decision. There are office procedures such as Resume and Urolift, and then OR procedures such as laser TURP and TURP. There are other options including laser enucleation of the prostate, aquablation, and prostate artery embolization done by a radiologist. I have a separate video on Resume and Urolift. The important thing to know is to find a urologist experienced in BPH, as we can improve your quality of life and help you avoid long-term damage to the bladder. I hope this video was helpful. If the content was, please like and subscribe and turn on notifications so that you can see future content as it is released.